When the Octuplets are ready to leave the hospital, they'll go home to this modest Southern California bungalow. It's where their single mother, 33-year-old Nadia Suleiman, lives with her parents and her 6 other children.
She's fine, the babies are fine, everybody's fine, except us because of you, that's all.
Yesterday, her father told reporters Suleiman hadn't been trying for multiple births.
She did not seek to have more children. She thought she was going to have one more child.
Her mother told the Associated Press Suleiman conceived all 14 children using in vitro fertilization. Earlier fertility treatments had left her with 8 frozen embryos that she chose to implant rather than destroy.
8 babies is trouble, oftentimes harming the health of the mom and sometimes harming the health of the fetuses.
Kaiser Permanente Hospital says the infants are doing well. The cost of their hospital care is expected to run into the millions.
Every one of us at some point is going to be asked to pay, either in insurance premiums, social programs, subsidizing medical costs that individuals can't bear.
Dr. Jamie Griffo calls this mega multiple birth bad medicine.
How many babies would be okay? What would you say?
In a single pregnancy?
Yeah.
Well, our goal as reproductive specialists is to help a patient have one healthy baby. And the reason for that is a single pregnancy is the safest pregnancy.
Griffo says most fertility doctors abide by guidelines set by the American Society of Reproductive Medicine, which would recommend implanting only 1 or 2 embryos in a 33-year-old woman.
There isn't a law that says you, doctor, can only transfer this number of embryos. You can't legislate the practice of medicine.
But some ethicists argue rigorous screening is a moral imperative.
It's not really, if you will, the old guard telling women what to do with their bodies again. This is different because technology opens up the door to make babies in new ways, to put risks and harms for children that didn't exist before. And I think all of us have a stake in trying to make sure that we protect the best interests of children.
New technology, but an old quandary. Just because you can, does that mean you should? Priya David, CBS News, New York.